And joining me here at the podium is Shirley from yesterday, Shirley Johnson. So we're just going to go down the list there. I hope everybody has now reviewed Keith's story. And let's start with group one. Hopefully you've got a reporter. And the question that was addressed to your group is, what would be an immediate phone response to Keith? Okay.
So who was in breakout one? Who's going to be our reporter?
Hi, my name's Veronica. We had kind of elected Mary, but I think she had to take a call.
Oh.
So I'm not sure what happened. So I don't want us to be silent like we were yesterday.
Okay.
Thank you, Veronica, the champion this morning.
Yes, ma'am. So what we discussed was, the main thing was to find out what the issues were with him, why he presented just to the ER. Was he not assigned to, a case manager or a sickle cell position? I think we discussed, let me look at my notes real quick, about educating the staff in the ER because of the negative connotations that they were giving out. And just basically the main thing was to focus on Keith and to see, why is he presenting to the ER every day? What was his goal of care that he wanted from us, as far as, do you want to be where you're not in crisis all the time, or do you just, not want to take the time to go to a doctor's office and what have you? So that was the main thing. We needed to find out what his goal for his sickle cell treatment would be and why he was not getting the treatment that he needed.
Mm-hmm.
Excellent answer.
Yeah, very good. Person-centered concept, I would say. Okay.
So the second question is, how would you describe Keith's family support? What would be a helpful strategy in this case? So who's our reporter for room 2? Do we have a reporter for room 2? Come on, don't be shy. Anyone that was in room 2 would like to unmute themselves and be the reporter?
Good morning.
Good morning.
I can volunteer as a reporter.
Sure, go ahead.
Great.
So we discussed one option is getting a release and contacting his providers that did the transplant to see what supporters he had done, and evaluating how that it might change. Also calling a family meeting and having him call in with the closest support system to find out what is actually going on at home, and exploring that nature, because it seems like there's something has changed, and we need to identify what is he actually going through at home.
Good point.
I really like the idea.
Or does he even have a home?
Correct.
Yeah.
Right. Mm-hmm. I like the idea of looping in the transplant team. Mm-hmm. That's a great multidisciplinary collaboration that in cases like this, might be helpful, because they may have a longer history with the person, or we may have a longer history with the person, and by putting our two heads together, might be able to come up with a solution. So thank you for that. That's a great idea.
And can I just ask, Veronica spoke for one, and your name was?
Santina.
Santina?
I'm Santina.
Oh, okay, good. And all right, we'll move on to I think we're on question 3. Are issues regarding cultural competence, cultural awareness, or cultural humility present in this case? And so at least state your name. And if you want to state where you're from, that would be great too.
Okay. I'm from group 3. I'm Wendy Curran, and I'm from Madison, Wisconsin, and it's snowing right now.
Oh.
Oh, so sorry.
We are sorry.
We're experiencing allergy season here today.
Yeah. Okay, Wendy.
So our question was about cultural competence, cultural humility, and cultural awareness. And yes, all of those things are areas for improvement. They are absolutely part of what Keith is experiencing. Our group started out right off. There needs to be support of this patient and education for the ED staff, and possibly the case manager, right? Like, I don't know where the case manager is from, what their background is, right? We also talked about education as far as, or finding out from Keith what his culture is, right? Like, so what is his social background? That's part of his culture, his social supports. We're a culture of one, ultimately. So if you allow yourself to not feel like you know everything and ask the questions, but then also coming back around and addressing and using difficult language with staff, like this is racism, this is not okay, this is bias, so again, coming back around and letting providers and staff know that other patients can hear, that it is not appropriate, and that we need to make amends and probably come back around and tell the patient that, right? Like, this was not okay, and we have talked to the staff, and we are looking to improve.
Yeah, good.
Can I ask what your role is, what you do with sickle cell patients?
Yes, I am the primary nurse for the sickle cell provider, a nurse practitioner, and I have, for about 8 months now, been trying to advocate to have a nurse navigator role for our adult population. And we just ran into another budget barrier.
Of course.
So
yes.
I feel like I'm going to take every single presentation and plop it in their lap.
I think that's a great idea.
Yeah, great.
If you were listening yesterday, it's all about ask, and don't stop asking. So,
Yes.
Great.
Yes.
have you experienced a similar situation with a patient? Have they reported something from an emergency room visit to you that you've had to address?
Yeah, and actually even a stranger one where a patient said that as they were waking up in the post-anesthesia care unit, that they were saying how much pain they were in and calling for their mom. And they said, she can't be back here. And, we gave you enough Dilaudid to kill you, so you shouldn't be in pain.
Is this during COVID
And-
that they said this, that she couldn't have somebody, or he or she couldn't have somebody
Yeah.
back there?
Yeah.
Yeah.
But still, that other remark breaks my heart.
Yes.
Yeah.
And so, I mean, the providers addressed it, did a really good job. Our group is called Patient Relations. That Patient Relations was notified. She was able to identify some staff, and we directly went to that staff, and it actually was able to underscore our need for education. So our group has actually put together education, and we are doing a pilot project for a group of inpatient nurses and having them be sickle cell champions on specific units.
Wonderful.
Yeah, have to find
Yeah,
those
it's
champions.
been really rewarding.
Champions are the best. I mean, they really are. And they're always your go-to person. You can't go
Yes.
and, talk with everyone, different shifts, different, situations, but you have those champions, and they are really going to be the eyes and ears for you and vice versa. So I'm glad to hear that you are moving forward in that direction. Thank you.
Yeah.
We appreciate it.
Yes, thank you for asking.
Wendy, I'm going to put you on the spot, and you don't have to actually ask this, or answer this, but in the question, we used words like cultural competence, cultural humility, and cultural awareness. Did your group differentiate those concepts any, or would somebody else like to pipe in on, is there a difference in those words, or are they all interchangeable?
We didn't differentiate, so I would leave it to the group. I mean, we did kind of put it all in a bucket and say, we need to educate folks.
Yeah, okay, that's fine. And
I would
think,
say they're very different.
yes, who was that speaking? Please
hi, Ray.
speak up. Is that Ray?
That's
Oh,
right.
That's Ray.
Hi there.
She's our veteran SCCAPE person.
I would say that they're different just simply based on knowledge and then applying that knowledge. You can have the knowledge of different cultures, but as long as you feel like your culture, your way of doing things is the dominant way, and that it is the right way, it's very difficult to be humble in your approach. And so it's very important to know those differences so that you can apply that knowledge appropriately.
Right.
That goes back to our afternoon segment on day one, right? When we were talking about all those different challenges that, we are experiencing in our culture, in our society today, and how it impacts our patients. And so thank you both for chiming in. And we're hoping as we continue through this morning, through these questions and answers, that others will chime in, even if it's not in your group. We really welcome the dialogue. Right. Okay, so we move to room 4 or group 4. What is ethnocentrism? Is it impacting Keith's care? If so, explain, and what interventions are needed? So who's our room 4 reporter?
Hi, my name is Keshana. I am a nurse practitioner. I live in Mississippi, but I work in Memphis, Tennessee in a sickle cell clinic. And I've just been there just under a month. It was a month on the 28th, rather.
Awesome. Oh, so glad you could join us today.
Yeah.
For the whole week.
I'm very, very, very excited and have thoroughly enjoyed this conference.
Thank you.
So ethnocentrism, evaluation of other cultures according to preconceptions originating in the standards and customs of one's own culture. Mm-hmm. And then the question is it impacting Keith's care? It absolutely is impacting his care because he is kind of like falling through the cracks, if you will. Kind of falling through the cracks. He's been to the emergency room, been using it for his pain control for about 4 months, and then they decided to get a case manager on board after 4 months. So if they had intervened way earlier, then he may not have been made to feel the way that he was made to feel. And then the question, what interventions are needed? He definitely needs an outpatient hematology consult and get established with the hematology clinic since they do have sickle cell. They do have a sickle cell team there, although it's only one doctor that's been involved. So he needs to see that team. The case management consult, we had a question about whether it was a specific sickle cell case manager or just a case manager in the hospital, and figured out that it's a case manager in the hospital. So we thought that he would benefit from being seen by a case manager that actually works with sickle cell. He also needs a psychosocial assessment to assess his support system, his living arrangement. Does he have insurance and things like that? And then what interventions are needed? Definitely a lot of education, diversity training, sickle cell education in the emergency department, and then also to educate Keith on the resources that are available to him as well.
Okay. So let me ask a fallback question. First of all, excellent response. I don't know if prior to you coming to Memphis, you worked in another sickle cell program, but spot on. Remember we talked a little bit about building your team. So does your team in Memphis have all of those personnel in place that you were just talking about? Licensed clinical social worker, dedicated sickle cell disease case manager. Do you have those particular things in your program?
So we do have a dedicated social worker. I'm not 100% sure she's a licensed clinical social worker, but we do have a social worker in our clinic. We don't have a specific case manager, but we have, so I'll just go through our roles. We have 3 doctors that kind of rotate in and out. One is there more often than others. Then there's 2 nurse practitioners. I'm the newest nurse practitioner, and we are trialing a program to where I will go into the hospital whenever our patients are admitted to the hospital to kind of round on those patients there. Not officially a hematology consult, but to be able to go in, see the patient, allow the patient to be able to see a familiar face, and let them know that we're from the sickle cell clinic, and kind of review the chart to make sure they have the things in place that they need as far as their sickle cell disease, and then make sure they have appropriate follow-up when they get discharged from the hospital. And so then we have a transition navigator as well as a transition registered nurse. And our transition, both the navigator and the registered nurse go between our children's hospital, and then they also come and spend time in our clinic as well.
Excellent.
And then we have three RNs that are primarily based in the infusion part of our clinic, and they also see patients, help out with the patients in clinic, but then help out, like somebody is assigned to the infusion center every day.
Correct. Yep.
Yeah.
And then also part of my role would be to create space to allow patients to be walk-ins, to be able to take more walk-ins into the infusion center for pain control and things like that, to decrease the utilization of the emergency department.
Yeah.
Excellent program.
Excellent.
Well, we're glad that you joined it, and we're hoping that we were able to offer you some support here today. If you do need anything from our inpatient nurse practitioner, please feel free to reach out to us, because she presented yesterday afternoon, and she could probably help you with some of the tasks that you're speaking about. Okay, let's move on to
Absolutely.
room
My
5.
partner and I we're making a list of things to take back to our group to kind of help, revamp some things.
Perfect.
Great. Okay, we're going to move on to breakout number 5, and we kind of already touched on these, but I want to hear from you guys. Are there issues of racism and implicit bias suspected here in Keith's story? Explain your response.
Well, this is Ray Blaylark again.
Hey, Ray.
Hello. My name is Ray, and I am the executive director of Sickle Cell Foundation of Minnesota. I also have a young adult son living with sickle cell disease. He's 25 years old, and I actually just transitioned out of the clinic as I was part of the pediatric sickle cell clinic for 6 years as the patient family health advocate and patient navigator, care coordinator, and all other things.
All other things.
So our question again was, are there issues of racism and implicit bias suspected here? So I'm going to start out just simply saying that racism is always rooted in power. And clearly by the structure of the staffing and the comments that were made, there is individuals who hold the power and can shape the outcomes of this person's experience. And so based on that, that brings in racism. Someone also brought up a really good point, and that is that there is likely some racial hierarchy in their hiring practices. The fact that most of the influential staff that make decisions are white and others are not, and so we have to look at that. And then also the fact that this is a 30-year-old man. Keith is a 30-year-old grown man with comorbidities, and I will simply say if he was a bald eagle, he would be considered an endangered species. And so there would not only be cultural humility, but there would be social competence. Cultural competence, but there would be social competence. There would be the knowledge that we are already working with someone who we know has multiple causes of death, whether they have sickle cell disease or not. So that's the other piece. I would say that the lack of their recognition of his humanity and not knowing anything of his background, not that they have time to get the bio sketch, but they do have a few moments to learn a little bit more about him and to humanize him. And anytime you have no information, you are more likely to make assumptions, and it's in that space where bias lives. And then the goal should be to first address his pain so that he can receive the conversation. And then you can begin talking about redirecting him back to the sickle cell program. But I would caution that some of that conversation should include what has his experiences already been, because there may be some trust issues that hospital as a whole has, particularly given that he has overheard that. So he's already experienced aggressions in that way that need to be addressed, not just from the perspective of sweeping it under the rug, but addressing how that impacts his psyche. So yes, the answer is yes, and that's our explanation.
All right, let's move on to room
Yeah.
6. What is the most pressing issue in working with Keith? Who's our reporter for room 6?
I think that's me. Hi, my name is Trista.
Okay.
Hi, Jessica, go ahead. Tell us about yourself, where you're from.
I am in Baltimore, Maryland at the University of Maryland Medical Center. I am a registered nurse in the emergency department, pretty much working clinically right now. And I am actually the sickle cell infusion nurse for the adult emergency department.
Wow.
So unique perspective, I guess.
Yeah.
I've actually dealt with these almost exact scenarios quite often.
I would be shocked if you said you did not.
Right. Yes, we are in our hospital trying to build a more comprehensive sickle cell program. It's just a handful of us right now, but we're hoping to do some great things and we're working on that. So yay.
Well, welcome.
Yay.
And we're hoping we were able to give you a lot of information. And I love
Absolutely.
your ED perspective, the fact that you recognize these, like Ray was just saying, obviously these situations are probably in every hospital. And, you know, I don't ever like to, you know, point fingers that someone really doesn't want to try to do what's better for patients, especially patients of color, but we've experienced all of that for those of us who are working with the sickle cell population, and we've heard stories and have witnessed situations where, you know, it's very troubling. So thank you. I'm glad that you're with us. Hopefully we're able to give you a lot of information today and you can continue to build your program. Remember, we started with a handful or less of people as well. So now we're up to 16 staff people. So there's hope. So don't give up. Okay, let's move on to room 7.
Okay. Oh, did you want me to answer the question?
Oh yes, I'm sorry. Go ahead.
It's okay. So the question is, what is the most pressing issue when working with Keith? And I would honestly say that the most pressing issue at this time is now going to be reestablishing trust. Anything that we attempt to do with him at this point is he's going to brush it off. He's going to ignore any offers of advice or help or anything. Now that he's heard these absolutely inappropriate comments, we're kind of like we're at a standstill until we can take the time and reestablish trust with him and do what we can to move past this unfortunate, terrible incident.
Yeah.
And I think that reestablishing trust will also, has been previously mentioned, educating staff. Part of my role in the department is educating our staff on patients that we see constantly. Sorry. So yes, reestablishing trust is most important.
I know I had to kind of run through that yesterday, but I want to really stress to people who are out there hiring staff. You could train people about what sickle cell disease is, but you have to have the buy-in of the individual you're putting in that position who is dedicated to understanding health disparities and is willing to work and be, you know, part of this integrated team. And so don't always focus on that resume of how much experience someone has, which of course that's always really important, but you can have someone with a lot of experience and they're still not the right person for the job. So kind of keep that in mind as you're reading this scenario and you're thinking about building your program. You know, A and B come in the room. A has a lot of experience, but I really feel this great vibe from B. Go with B. You could train them on the situation, on the sickle cell disease piece of it, and that is really important on building that team. Okay, we're going to move on to room 7. Thank you so very much for that. Good luck to you in Baltimore.
Am I reading? I've lost track.
Yep.
What strategies could be used to establish a working relationship with Keith in room 7? I know there have been a lot of good suggestions already, so do you have something that you can add from your group?
Hi, so my name's Ellie Webb. I'm a nurse practitioner at the Children's Hospital of the King's Daughters in Norfolk, Virginia.
Oh, hi, Ellie.
Hi, Ellie.
Hi. So we had talked about trying to hook him up with the sickle cell team because it looks like the hospital has an established program. So getting him in with them. But we also talked about finding a case manager or community outreach person who can kind of get to know what what may be the barriers to getting him with the sickle cell team. So, his family doesn't seem like he has much support from them. So does he need transportation? And then also housing seems to be questionable. So just kind of getting to know him as a person and seeing where his major needs are to help get him to a place where we can have a working relationship with him.
Okay.
Okay, we have 2 more rooms. I think we're going to go over a little bit, but I think it's okay to do that. We're just going to shorten our break a little bit this morning. What sickle cell disease medical care team member should be included in Keith's plan of care, and what kind of interventions would each team member initiate? Again, I know we touched on this a little bit, but I do think there's probably more suggestions out there. So who is our room 8 reporter?
Okay.
Do we have anybody that was in room 8? Well, I think, again, it's really important to identify champions. So if you have a sickle cell disease program, you want to make sure that you are having that case management, social work person who could maybe be the go-between between maybe the ED champion, if there is one, or the ED nurse or the nurse practitioner along with your team. So I would highly recommend that, case management is extremely important. I know through the COVID pandemic, our patient navigator team has been instrumental in kind of keeping all of us in play. So whatever you call that particular person, I would say they're the go-between between that communication of what goes on around the multiple players. So that would be really important. And I think also, you have that dedicated clinical provider, whether it's your nurse practitioner, your physician, you want to make sure that you're getting that clinical component in there as well. I think one thing that I've noticed nobody's brought up, and I think it's really important if it's possible, is there's some general terms that could be used in a treatment plan for individuals with sickle cell disease. And there's sometimes when our nurse practitioner has had to put a treatment plan together where we might not have had a lot of contact with that particular patient for whatever reason, but we're still able to look at his medical records and come up with a plan of care. That might be something that would be helpful as well to the emergency room staff. And if they knew how to access it, whether it's a resident, an attending, somebody new coming in. So, maybe an idea would be figuring out who can put a generic treatment plan together till you can get this particular patient, into a sickle cell program or seeing a provider. And then that way maybe the emergency department wouldn't feel so frustrated because this particular person keeps coming back in. So that would just be another suggestion that I would make. And then we're into room 9, our last room.
What community resources would you seek to assist in helping Keith, who could lead in activating those resources? And we've already heard several, but those of you that were in room 9, you have a chance to add yours.
Hi, everybody. My name is Julie Mason. We didn't actually have a lot of discussion in our room. We had a sleepy crowd. But I talked a little bit about, what everybody else has talked about as far as community health worker, a case manager that's a strong advocate for, this particular guy, not only for the sickle cell, but also because he's had transplant in the past. Usually people that have had transplant have a lot of residual issues and, making sure that he's well connected there. The other thing is the idea of, looking at what his interest is. I see that, he had been in advertising in the past. So if a community health worker really looked at that and saw, perhaps, getting him involved with that again would be really important, or, just tapping into his interests. Let's see, there was a couple of other things I thought about. The other thing is, there are great sickle cell foundation groups across the country, and it didn't really say which state he's in, but, connecting him with that resource and, people that can provide him education and some other peers, right?
Excellent.
Excellent.
And where are you from, Julie, and what do you do?
I'm the nursing supervisor that works with a group of great educators with CVS Health, and we're just getting started with sickle cell. So there's a number of us actually that are enjoying this conference very much and learning a lot. So
we're so happy to have you.
I'm happy to be here.
Thank you so much. Yes, as you can see, the partnership with pharmacy is extremely important as well to keep patients out of the emergency room and being able to make sure that their medications are being distributed on time. So we're glad to have you here. I think that we just want to wrap this up. We wanted to move. I know it's a little early. We just got started today, but because of the way our content is flowing for the remainder of the morning, we didn't really want to break it up too much. We do know that being on Zoom, you're able to get up, stretch around, and do those kind of things. So we don't really want to make you feel like you can't leave your seats. But we are going to take a quick break. We're going to come back at 9:45. We do appreciate all the dialogue and keep putting questions and comments in the chat box. We could always come back to those later today or first thing tomorrow.